Diagnosing anxiety is a process that involves both medical and psychological evaluations. Anxiety disorders can often present in different ways, so it's essential to approach diagnosis carefully to ensure that the correct disorder is identified. This process typically includes 1. Medical evaluations. A healthcare provider, such as a general practitioner, will often start by ruling out any underlying medical conditions that could be causing or contributing to anxiety symptoms. Some health issues, like thyroid problems or heart conditions, can mimic or worsen anxiety. The doctor may perform blood tests, ask about your medical history, and inquire about any medications or substances like caffeine or alcohol that could affect anxiety levels. 2. Psychological evaluations. A mental health professional, such as a psychologist or psychiatrist, will conduct a thorough psychological evaluation. This involves discussing your symptoms in detail, including when they occur, how long they've been present, and how they impact your daily life. The goal of this evaluation is to understand the severity of the anxiety, its triggers, and whether it's linked to any other mental health conditions, like depression or substance abuse. 3. Self-report questionnaires. You may also be asked to fill out self-report questionnaires or screening tools that assess anxiety symptoms. These tools help mental health professionals gather more information about your experiences with anxiety. Common examples include the Generalized Anxiety Disorder 7, GAT-7 questionnaire, or the Beck Anxiety Inventory, BAI. While these tools can provide valuable insight, they are not used alone to make a diagnosis. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our Mental Wellness Hub on the Happy app. Click the links in the description. Once a thorough evaluation has been completed, the mental health professional will compare your symptoms against established diagnostic criteria. The two primary classification systems used for diagnosing anxiety disorders are the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, and the International Classification of Diseases, ICD-11. 1. DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition. The DSM-5, published by the American Psychiatric Association, is the most widely used guide for diagnosing mental health conditions in the U.S. It outlines specific criteria that must be met for a diagnosis of anxiety disorder, including the presence of excessive worry, physical symptoms like restlessness or muscle tension, and the length of time these symptoms have persisted, often at least 6 months for generalized anxiety disorder. Each type of anxiety disorder has its own set of criteria. 2. ICD-11, International Classification of Diseases, 11th revision. The ICD-11, developed by the World Health Organization, is an international classification system used globally. While similar to the DSM-5, it provides slightly different definitions and classifications for anxiety disorders, making it more applicable to a global audience. The ICD-11 also includes specific codes used for tracking diseases and health conditions, including mental health disorders like anxiety. Both systems are highly reliable and ensure that the diagnosis is based on objective criteria, reducing the chance of misdiagnosis. However, a diagnosis is not always clear-cut, and healthcare providers often use clinical judgment to decide which diagnosis best fits a person's symptoms. Anxiety disorders can sometimes be tricky to diagnose because their symptoms often overlap with other mental and physical health conditions. This makes it crucial for healthcare providers to consider other possibilities before making a final diagnosis. Some common conditions that may be mistaken for anxiety or that can co-occur with anxiety include 1. Depression. Anxiety and depression often go hand in hand, and their symptoms can overlap. While depression is typically characterized by feelings of sadness, hopelessness, or a lack of energy, anxiety focuses more on worry, fear, or nervousness. However, people can experience both conditions simultaneously, which can complicate the diagnostic process. Differentiating between the two is important because treatment strategies may differ. Number 2. Thyroid disorders. Hyperthyroidism, an overactive thyroid, can produce symptoms that closely resemble anxiety, such as rapid heartbeat, nervousness, and restlessness. That's why a thorough medical evaluation is necessary to rule out any physical causes before making a mental health diagnosis. 3. Heart conditions. Panic attacks, a common symptom of panic disorder, often mimic heart-related symptoms such as chest pain, shortness of breath, and palpitations. Many people with undiagnosed panic disorder seek medical help, believing they're having a heart attack. Therefore, doctors must rule out any cardiovascular issues before diagnosing panic disorder. 4. Substance use disorders. Alcohol, drugs, and even certain medications can cause or exacerbate anxiety symptoms. It's important to assess a person's substance use when diagnosing anxiety to avoid mistaking substance-induced anxiety for an anxiety disorder. 5. Attention deficit hyperactivity disorder, ADHD. ADHD and anxiety share some similar symptoms, such as restlessness, difficulty concentrating, and irritability. However, the underlying causes of these symptoms differ. People with ADHD often experience anxiety as a secondary issue, making it important to assess for both conditions. 6. Obsessive-compulsive disorder, OCD. OCD is sometimes misdiagnosed as generalized anxiety disorder because both conditions involve excessive worry. However, OCD involves specific obsessions, recurrent intrusive thoughts, and compulsions, repetitive behaviors, which are key to its diagnosis. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our Mental Wellness Hub on the Happy app. Click the links in the description. Finally, although this course was free for you, it was not free to get it to you. Please consider giving a small donation to help spread these courses around the world to those most in need. The link is in the description. See you in the next lesson.